Hi Grace, my name is Lockie, I'm a physiotherapist today. How are you going?
Yeah, not too bad.
That's good. So it looks like you've got a little bit of back pain there, is that right?
Yeah.
Okay, can you tell me a little bit about that?
So for the past year now, basically, I've just been having this back pain coming and going, quite randomly, I think.
Yeah.
And so about a week and a half ago, I thought it would be about time to go and see the GP about it.
Mm-hmm.
So I went to the doctor and he sent me for an MRI. Then I came back and he referred me to you.
Okay, sure. And have you had a chance to get back to the GP and for him to explain those results to you?
Yeah, so I went half a week after the MRI, and he said to me that he saw I had OA in my back, whatever that is. He said basically it meant the bones were wearing away a little bit, and he saw a disc sticking out of my spine, which kind of scared me a little bit.
Okay, sure.
He said that's probably what's causing the pain.
Okay. And after you saw the GP and sort of found out these results, did you notice any changes in your pain?
Yeah, now that you mention it, I went home that night with the MRI results, and I wasn't doing anything different. I was just making dinner, and all of a sudden, my back just started to flare up, a lot worse than normal. And I went and lied down. I tried to deal with it how I normally do, and it just didn't go away.
Okay.
And it's just been like that for the past week.
Okay. Well, that sounds really quite uncomfortable, Grace. Can you tell me a bit about why you think that might have changed?
Honestly, I have no idea. I've been doing the same stuff. All I can say is I'm a lot more conscious of it now.
Yeah.
I think after seeing those MRI results and knowing that it's a lot more severe than what I thought it was, I'm just too scared to move it. Because I've heard people at work, right, with the same condition, and they say they push it or something, and then they're bedridden for like a month or so. I just can't afford to do that.
Yeah. And that's a completely understandable response to a situation like this. Before we get too far along, I just want to just unpack a couple of those things that you've mentioned.
Right.
Just review those MRI findings and what they actually mean. Does that sound okay to you?
Yeah.
Okay, great. So we'll start with the OA, as you mentioned. That's osteoarthritis. So basically, this is a degenerative disease of your joint, and it's basically just associated with aging. So this is a normal process with aging of a lot of people. Okay. On your MRI results, there was only minimal signs of osteoarthritis. Okay. And this mild osteoarthritis on the MRI findings, there's been shown no correlation between this and lower back pain. Okay. So you can rest assured that this osteoarthritis is not going to affect the integrity of your spine at all. Does this make sense?
Okay, so I understand that osteoarthritis, you said, isn't what's causing me that pain in my back. So is there anything that the MRI findings are telling you at all?
Well, as physiotherapists with lower back pain patients, such as yourself, we really don't like to refer them on for an MRI unless we do suspect a more serious pathology.
Does this mean my GP is pretty concerned I've got something serious?
No, definitely not. GPs are a bit different. They prefer to get some visual reassurance of what they suspect. There's a couple of positives with this. The fact that he's referred you to me suggests that he's on board with physical intervention, such as exercise, which is going to improve those symptoms. The other positive is we've also been able to rule out those more serious pathologies.
Okay, well that's good. I'm glad you guys want me to get up and moving again, but I'm still a bit concerned about that bulging disc in my back.
So bulging discs, similar to the osteoarthritis that we discussed earlier, they're found in a lot of people, but once again they have a really poor correlation with lower back pain. There's been studies done on participants that didn't have any back pain at all, and they've taken MRIs of their backs, and up to 2/3 of those patients actually had disc bulges that they actually weren't aware of. Okay. So this again shows us that, once again, these findings that we're seeing on the MRI really don't have any correlation with the pain you're experiencing. Okay? Alright, so unfortunately, in a lot of cases, and as I'm starting to suspect with your case, these MRI findings can actually start to become a bit of a driving factor for your pain. So before we received these findings, you weren't aware of these structural abnormalities that were in your back, but now that the findings have been highlighted, you become overprotective of your back, and you start having a really overprotective structure, and it can lead to actually increasing your pain. So it's what we actually call hypervigilance. Okay, so just to make sure that you understand what I've just said, can you just let me know what your understanding of the disc bulge is?
Yeah. So what you said was that a lot of people have that you call disc bulge, and they can actually go quite painless with it, which is reassuring. It's telling me that maybe that's not causing my pain, and the fact that and it does make sense. When I went home that night, I was thinking about it more, and it started to hurt heaps more because I was thinking about it, and I actually had something that I thought was causing it that wasn't. Does that sound right?
Yeah, exactly right. So as we said, now that you've seen those findings on the MRI, you've become overprotective of your back, you start moving differently, and then that ends up increasing your
Okay, so yeah, that makes a lot of sense. And I guess for the past week and a bit, I have been keeping my back pretty still because, I was just too scared to move it.
And that's a perfectly normal response, but we know that these MRI findings that we've been discussing, the associated pain, really aren't predictors for chronic lower back pain. The things that we're more concerned about is your mental approach to the treatment and you refusing to let your back do what it does best, which is moving and providing stability for you, which can really cause further harm.
Okay, so I understand that you guys probably want me to move my back again, and that moving my back is probably the best thing for me to do. But I just feel a bit too hesitant because of that pain still.
And this is completely understandable. However, we know that stiffening up your spine prevents you from effectively distributing the forces across your spine, and this can lead to you loading your back in non-optimal ways and stressing some of those structures more so than usual. And this could explain why you're feeling worse than before.
Okay, yeah, that sounds good. So moving forward, what do you think we should do?
So firstly, what we're going to do is try and vary your posture as much as possible. Okay? We're going to avoid any prolonged sitting, and we're also going to use some of those gentle range of motion exercises that I showed you earlier. This will hopefully allow us to get some normal movement back into your spine, really start to desensitise some of those structures that are causing pain. Okay? Once we do this, we can start to load your back again and really increase the inherent structural stability of your spine and provide those structures surrounding the spine with further stimulus for you. How does that sound?
Yeah, it actually doesn't sound too bad. I'm happy. I'm keen to get my back moving again, actually. So yeah, good to see what happens.
That's great. Positive mind frame like that is really going to take you a long way, Grace. So I'm really proud of you taking this first step in your rehabilitation.
Thanks.